All right, let's talk about integumentary problems, common infestations, and insect bites. This is 5 slides. So, common infestations: bees, wasps. Don't even. I do not. Will not have to know the species, so don't worry about that. But what happens if anybody's been bitten by or stung by a bee or wasp? Intense burning, local pain, swelling, and itching, severe hypersensitivity to that area. But if that severe hypersensitivity extends, you can have anaphylaxis. For any of you who have seen the movie My Girl in the 90s, the little boy Macaulay Culkin died from bee stings. Cool compresses can help. Local application of antipyretic lotion, antihistamines, usually uneventful. And I will tell you that lavender oil immediately helps the pain on a bee or wasp sting. Bed bugs, feeding periodically, usually at night. They're in furniture. It's making me itch right now. Walls during the day. But this is so somebody who has bed bugs. Their history, if they've stayed in maybe unclean hotels, but the bug bites have they look like small mosquito bites, but they can be in grouped areas, um, on the feet, the hands, areas that are uncovered, especially during sleeping. But they're very, very itchy. Lesions usually require no treatment. Pesticide control, allergen mattress wraps can help. I'm really starting to itch now. Now we're going to talk about head lice or body lice, pediculosis humanus capitis or corporis. Again, you don't need to know those. Seriously, is anybody else itching? So these are parasites that suck blood and then they poop in your hair and they leave the eggs on the skin and hair. And so they attach to the skin. So this is not necessarily considered a dirty condition. So I don't know about you guys, but when I was growing up, oh my gosh, anybody that had lice was just so unclean and terrible. But that is not necessarily the case. They can adhere very well to very clean hair. So now they have these sprays they're called lice away, where they'll spray the skin spray the hair. It's kind of like a hairspray or mint kind of spray, and it attached to the hair, so the nits and the eggs can't stay on the hair. Transmission of pubic lice due to sexual contact. I can't really think about how else that could be transmitted. But some of the lesions, like a school nurse is looking in the hair, because it's really common in kids, right? They share hats, they're touching each other. Yeah, their heads are close together. So itching is a big one. Wheal-like lesions in the skin, but also what they're looking for, which is easier to see, are these nits that are attached to the hair. Although this is the treatment that's listed in your book, lice is becoming more and more resistant. So I'll tell you about my home remedies in class. Scabies. Scabies is rarely seen in dark-skinned people. Off the top of my head, I cannot tell you why. Transmission is by direct contact, only occasionally by shared personal items. But what it is, so this is gross. I'm going to gross you guys out. So the scabies, this bug, will go underneath the skin and then start to leave the eggs and excrement in the skin. And the itching, intense itching and redness is the reaction to being allergic to that, which is like I think is a totally normal reaction, being allergic to eggs and bug feces. So severe itching occurs, often like behind, underneath the skin, the webbing. They kind of follow in a linear pattern. So this person is going to be on contact precautions in the hospital. Vulnerable populations it's more common in. You're treating family members. You're treating the environment with plastic covering. And then antibiotics if there's a secondary infection, and you would see even more increased redness. Like this particular hand, I'd probably give this person secondary infections. Secondary antibiotics for a secondary infection. Scabies, ticks. So ticks can cause Lyme disease. So they're common. There's actually a lot in Texas. But what happens is the tick bites, the infected tick bites, then you can get a ring-like rash, flu-like symptoms. There's no acquired immunity, so you could continue to get infected. But this one does need oral antibiotics. Common allergic conditions in skin, allergic contact dermatitis. So that's when something touches the skin and the skin obviously doesn't like it, right? So they can get red papules, plaques. It can be really itchy, or it can even have like a burning sensation. Topical steroids are helpful, mostly just elimination of getting rid of it, or the elimination of the contact. Men that are allergic to certain metals or women with metals with their earrings, they can coat them in clear nail polish, which decreases the contact. All right, urticaria, it's usually an allergic phenomenon, and this is you might know it as hives. And so this irregularly shaped wheals are what show on the skin. It almost looks like the world map, or where it's kind of raised in areas, and it's actually kind of cool, but it's really itchy and it doesn't feel good. And if it's really systemic, certain people can get swelling and trouble breathing. So oral antihistamine therapy is helpful. And a diary is helpful to find out what's causing it. Drug reaction. So any person that's allergic to certain medications, very common penicillin. But the thing is, it can appear as late as 14 days after stopping of the drug, because it takes a while for the body to build up antibodies to it. It can be itchy. Usually rashes, red, either flat or felt, or you can feel it. Any morphology, urticaria or hives is a really common one. Some might be life-threatening, like Stevens-Johnson syndrome, but obviously treatment is withdrawal of that drug, antihistamines, corticosteroids if we need it. Atopic dermatitis. So this, again, this can be kind of an autoimmune almost, or it has to do with your own inflammatory mediators. Unlike the contact dermatitis, atopic dermatitis can kind of be like from the inside, might be food related, might be some kind of allergy related, associated with rhinitis and asthma. So those are environmental allergens or environmental irritants. So diaries on that can help. Corticosteroids, phototherapy, reduction of stress, because stress increases or it impairs the immune system. All right, that concludes insect bites and allergies.